and what seems to be the biggest
yes,
obstacle?
Yes. As the mayor said, we, not only immigrants, but we provide all who apply with the opportunity to enroll in this program.
But does that seem to be the biggest obstacle to getting people to sign up for cultural or language barriers?
There is, as one might understand, some hesitancy sometimes to persuade folks that both they are eligible and that there will not be some involvement with government agencies who may ask questions they don't wish to answer. We have always tried to ensure that the provision of social services, and the mayor has been really the leader on this, and we're going to be working in lockstep with the mayor and his administration, that we provide the services. We are not, and I said this for 8 years when I was Attorney General and we did labor cases, we are not the INFs. That is not our job, that is not our function. We are here to provide health care for children. That is what we will do.
Is expanding the eligibility to 400%, is that part of SCHIP, or is that something separate, and does that require federal approval?
The answer is actually both. We have applied for a waiver from CMS, and we can get that waiver independent of the authorization of SCHIP. But the good news is it was also built in to the bills that have been passed, House Bill and the Senate bill, I believe. And so if those bills pass, then statutorily we will get the waiver up to 400%, which certainly would be a wonderful thing to get written into statute. One could get, in other states, adopt waivers at varying levels of the federal poverty level. I think the highest raise percentage increase was up to 350. We are seeking 400 because that's the threshold we need to get the range of individuals.
And are you also seeking that outside of SCHIP?
Yes, no, we are seeking the waiver, and we are in the, I suppose one might call it a negotiation with CMS, of back and forth questions that are asked about what measures are taken to ensure anti-fraud steps, etc. So we are having that conversation. It's going very affirmatively, but certainly to get a statutory authorization would be great.
Didn't you also get the state legislature to approve?
Yes.
Asking for it? The governor worked with the state legislature and got them to approve the request, and now to go to the federal government. He goes to the federal government.
Right. Yes, ma'am.
As more people enroll in this program, are there plans to build more centers like the Ryan Center so that people can have community centers to go to?
There'll be expansion of capacity in each of the primary care centers to absorb, yes.
In fact, let me just add on that. One of the, and Richard obviously will give you much finer detail than I could, but one of the efforts we are going through, and the Berger Commission was one piece of this, is to change the institutional structure of our healthcare delivery system away from the bricks and mortar that are institutional hospitals and towards a primary care structure in community centers such as this one, lower overhead, lower costs, more efficient delivery, and the primary care access that we want so people don't end up in the ER, which is the ordinary course of events if you go to a major institution.
Does this SCHIP legislation require for you necessary for you to campaign process of ensuring every
I would phrase it differently. I think SCHIP is necessary for us to attain the healthcare objectives we have as a city, a state, and a nation. I think that is why you saw overwhelming numbers in the House, bipartisan support. What was the actual vote in the House, Jerry? Do you remember? Overwhelming. It was not at all a party line vote in the House of Representatives. It was a 68-31 vote in the Senate, which, as Jerry said, by a margin of 1 is theoretically veto-proof. So I think that this is a critically important step for us as a nation in terms of health care. Yes, it is also important for us as a state in terms of the funding levels we want, the exemption of 400%. So I'm certainly, I share Jerry's final point. It would be a shame if the president were to veto this bill that has such broad-based support and is so necessary for the good health of our citizens.